Uh, Hello, and thank you everyone for joining True's latest Transit Tuesday talk. My name is Megan Owens. I'm the director of Transportation Riders United, joined today by Zanaya Kelly, True's community engagement manager, and who is leading this great Transit Tuesday talk series and so much of our community engagement work. So we are thrilled to have everyone. I hope others aren't having technical difficulties. We had about 3 times this number of people registered, so hopefully people will be hopping on shortly. But True hosts a series of these Transit Tuesday talks that that really work to bring transit agency providers and transit decision makers together with riders and other community members who have an interest in public transportation so that we can have a better understanding of what is happening in the transit world behind the scenes and all of the great ways that transit helps engage and improve and support our communities. So we had True hosted just last month our State of Transit event, and we did have here at that event from transit agency leaders from SMART and DDOT and the ride, some of the largest transit providers. But we know that they are far from the only transit providers. And we are thrilled today to be joined by some of the providers who work in some of the less dense parts of the Southeast Michigan region, providing super critical services that connect seniors, people with disabilities, and others to the places that they need to go. And True's mission is really to ensure everybody can get where they need to go, regardless of whether they drive. So, very important service that our providers offer. So, we are going to hear from our friends at WAVE, sharing a little bit of what's happening in the Western Washtenaw area, and then from People's Express and from WOTA. If there are any pressing questions specifically for that provider, we can take a couple of questions right after they present. But then I want to open it up after we hear from all three of them into more of a discussion and a broader Q&A about how we are serving these very important communities and audiences. So thrilled to be joined by Marie. It's Gress, right?
Correct.
Okay.
Yep.
I should have double checked that before, but thank you so much, Marie, for joining us. And we are excited to hear more about the service that you guys provide, the people that you serve, any progress or improvements that you've seen in recent years. So, if you want to take maybe 10 minutes to give us an overview of what the service is, you should be able to present if you have any slides. Oh, there you go. You are ready to go. Thank you
Yes.
so much for joining us, Marie.
Yeah, thank you so much for having me. Talking about rural transportation is so important. And then um, for rural Western Washtenaw, it's a lot bigger, right? Because we're at the edge of Southeast Michigan, and we're not pulling quite as many people into the depths of Detroit. And so we appreciate the being included in this kind of conversation. So, in case anyone's not familiar, WAVE stands for Western Washtenaw Area Value Express. And we provide rides to all of Western Washtenaw. And when my background is back up, you'll see my map behind me. I always keep that on my background. But WAVE is a 501c3 nonprofit organization dedicated to providing transportation for all in greater Western Washtenaw County to enhance their access and opportunity to our communities, whether that's healthcare, social services, employment, education, recreation, caregiving or caregiving respite, community events. We try to, be as nimble as possible to serve the community in whatever ways that they need as far as passenger transportation. And then an added benefit as a nonprofit, we rely on a lot of generous donations and grants that sometimes are only available to an agency like ours. I'm not going to read through this whole timeline to you, but it is our 50th birthday this year, our 50th anniversary. We were founded in 1976 when a retirement community got together with a few service organizations like the Jaycees, Rotary, Kiwanis, and they created Chelsea Area Transportation System, or CATS for short. They used volunteer drivers and volunteer dispatchers. And really, when we started, we were targeting that retirement community. They could no longer offer transportation on their own, so partnered with the municipality to get those state and federal funds to offset the cost of transportation. And then we didn't even have our first executive director until 2000. And after that, we just slowly started adding the townships and municipalities around us to where we are today. And as far as our impact goes, you can see that prior to COVID, we were staying around that 40,000 line, a little below that COVID drop hits. That's a pretty obvious little drop here. And then we were staying in the 21,000. I think this was 23,000, 27,000, and then we had a big boom in fiscal year 23, or I'm sorry, 24, with 36,000 rides. And this past fiscal year 25, was over 55,000 rides. So we have surpassed where we were prior to COVID. When we talk about 55,000 rides in a year, on average, it's 150 rides a day and over 1,300 miles a day. How we got here, I'm sure we'll talk a little bit more about that as we hear from how WOTA has grown and People's Express has grown. But for Wave, we did a few things kind of at the same time, and it all made the perfect growth opportunity. So first, we hired a mobility manager, and we put that person in the community, going to senior centers, going to retirement communities, going to there's a community we have called the St. Louis Center that is for people with developmental disabilities, to do life skills, to live in community and things like that. We're going to mobile home parks. We're going to the schools to talk to youth. We're doing the library, touch-a-trucks, and all of those things. Halloween, we're decking out one of our spare vehicles to be the haunted bus for people to walk through. So we're in community much more intentionally than we were before. And then we also updated some of our scheduling and dispatching software. It made it a lot more efficient for our dispatch. It made it encouraged a lot more ride sharing, and it had an app component for the rider so they could control their own rides. They could get notifications from their rides without having to rely on our super small dispatch. When I started at Wave in 2023, we had one dispatcher. And now we have two, and sometimes our transportation supervisor kind of jumps in on that when we get really busy. But just those couple of changes really made a really big impact. Some of the services that we provide are door-to-door service. That's a demand responsive service. We've got a couple of deviated fixed routes. So the Chelsea Community Ride is a downtown circulator, and then connector routes that are deviated fixed routes as well that connect Chelsea Dexter to Ann Arbor. And then also there's a really busy part of one of our townships on Jackson Road corridor that's got a lot of businesses, and then a handful of high density communities, low income communities. And I've got a map on that in a minute. We've also been try to be really intentional with our group trips and our community shuttles when there's community events. And then we've been trying to be innovative, probably isn't the right word, but like, hey, community, let's try out a couple of different ideas to see if this is a need. Like, we're hearing that some people want late night service. So if they go to the bars, they can have a ride home. So let's try this late night service in one of our communities. And so that was a pilot that we did in this past year. Again, I'm not going to read through this entire slide for you, but this is what our demand response door-to-door service looks like. The orange area is our primary service area. And so any ride within that service area is going to cost $1 unless you're one of our more vulnerable communities, if you're part of any of the discount groups that we have going at the time. So older adults, people with disabilities, people with low income, and youth are the ones who get half off their ride at this time. And we actually take anyone from our primary service area into the rest of Washtenaw County. So if that's to transfer to the ride, if that's for a medical appointment out in Domino Farms, if they've got a friend down in Milan that they want to visit, we can take them where they want to go, whatever the purpose is. We actually don't even ask the purpose. We just try to prioritize the rides as they come in. Our service is available from about 6 a.m. to 9:30 p.m. And we have a new partnership with Washtenaw County. So a lot of counties in the state of Michigan have an older adult millage, but Washtenaw County didn't have one until about a year and a half ago. And they have identified transportation as one of those critical needs that older adults have in our county. And so they've been partnering with a couple of us transit agencies to cover the entire cost of the ride for older adults. This is primarily on the door-to-door service and not for the other ones, but this has been extremely beneficial as there's been a lot of changes at the state and federal level when it comes to some funding opportunities or the flow even of that funding. Chelsea Community Ride. So I'm just going to focus on the map for you here right now. So Chelsea is a small urban area, and they do have 2 retirement communities in this area. The Chelsea Community Ride is something that we inherited and built with the Chelsea retirement communities when they gave up their transportation service for their residents. And so the first handful of stops are in their more populated residential community. We've got a low income housing here, and then the Pines is also part of the Chelsea retirement community. So we make sure to stop by all of these on our loop. And then as we go out, we make sure to stop at the bank, and there's a strip mall here with shopping and a gym. We go down to a grocery store, the optometrist, pharmacy, post office. There's a wellness center. The professional building is part of the hospital system. So those are both very well used, frequently asked for destinations for rides for those medical services. And then up here at the clock tower, this is right next to the Jiffy. So if you're familiar with Jiffy, that's in the city of Chelsea. So right across the street is the clock tower. That's a shopping. There's physical therapy. There's restaurants. It's also highly requested. And then, of course, the senior center. So that's the primary loop for our downtown Chelsea community ride. And this is a deviated fixed route. So that means that while there are stops and points of interest in a typical schedule that we follow, we can also go off of the schedule a little bit if someone is nearby and needs that ride, which has been extremely helpful to have that flexibility for a rural service. Next up is our connector routes, connecting Chelsea to Dexter to Scio. And the thing that I really want to point out here is that we connect with the ride. We have a very close relationship with them. They are a pass-through agent for some of our funding at the state and federal level. And we know that Ann Arbor is where a lot of our residents want to go. And so instead of bringing each and every person all the way into the depths of Ann Arbor, we try really hard to make the most of our resources and their resources with this transfer point here. I mentioned the group trips and shuttle services. These are one-off. They have to be approved groups with the Michigan Department of Transportation guidelines. Typically, this means senior programs, disability programs. Those are like a definite thumbs up, and there's some other ones that we have to get special permission for. And then I mentioned that we tried a late night service. We are doing it again this summer, and we're going to change some aspects about it, particularly the days and times. We offered a wider range, and so this year we're going to narrow that in based on the utilization that we had last year while still allowing for some room for growth. Rider testimonials. So, like, who's using this service? How is it benefiting them? We've got a quote here from a caregiver that, in essence, saves her. Thanks to Wave, I now have almost 4 hours, 3 days a week to myself for errands, chores, coffee, or even to go to movie with a friend. I definitely couldn't have done that before. So in rural areas, it takes a while to get to where you need to go. And those 20 minutes there, 20 minutes back, 30, 40 minutes there, 40 minutes back, those all add up for a lot of people, particularly caregivers. And so we're so glad that a service like ours, it's really just like, we're just providing transportation, right? But the word's escaping me, but that side benefit, that like fringe benefit, there we go. That fringe benefit of caregiver respite is such an important part of the how we play into the ecosystem and the infrastructure. We've got volunteers. We had a college student riding the service who had her own vehicle. She can drive, but she was a mom too. So she would use the time for Wave driving her to and from her schooling to get her homework done while she was on the bus. And so she didn't really mind if she was ride sharing with somebody and the ride took longer. It just gave her more time to do her homework. So when she was home with her family, she was spending more time with her family. We recently started a registration program, so we actually have a little bit more information on our riders. Part of this was because with the senior millage funding, we have to prove that any rider the county millage funds are paying for is a Washtenaw resident who is 60 plus. And we're learning a lot more about our riders. 5% of our ridership is youth. 79% are 60 plus, 44% of our ridership have low incomes, and 65% have a disability. Please excuse the last bit. It was supposed to be a reminder to myself to pull the caregiver and veteran stats for you too, but clearly I didn't follow through on that one. I can get that for you because we asked those questions. These are a list of some of our partners. We really couldn't do the work that we do without the buy-in from our community partners, local units of government, from some of the groups that just really do a little bit extra for us. There's no money exchanging with, say, the libraries per se, or the senior centers, but we're talking about them and they're talking about us, and that's all very helpful to the work that we're doing. Sponsors and donors, grantors. I mentioned we're a 501c3, so this is an important part of the connections that we're making to ensure that our rural transportation system is able to benefit the entire community. I struggle to stop my sharing. There we go. And
Wonderful.
yeah, thank you.
Thank you so much for sharing. I grew up not far from the area and I have family in the area and had no idea just how many different types of services you guys provide. So that is wonderful. And there were a couple of comments complimenting the use of the deviated fixed routes. I know that a regular fixed route doesn't necessarily work in some of these more low density areas, but I love the efficiency of moving more people through
Mm-hmm.
those. Um, are there any quick questions specifically for Marie?
Thomas has his hand up.
Oh, all right. Thank you. Um, sorry, where did my, uh, let me see if I can. Okay. All right, Thomas.
Hi, can you
And
hear
then,
me?
yes, and then we'll go to
Okay.
Nikki.
I just have a really quick one, which is you may have mentioned this, but are wave services open to anybody? Like, let's say I'm coming to Ann Arbor from Detroit, and I'm in there for the day, and I want to go use one of the fixed or deviated routes to get to one of the destinations. Do I have to be a resident of those communities to use the service, or can anybody use them?
Anyone can walk on.
Wonderful. I just wanted to say one thing as well, which is I appreciate I also was not as familiar with Wave, and just the variety of services that you guys do, I think seems like a good model for some of the other agencies that are similar. You got kind of a variety of different services that meet a lot of different needs, not just one demand response service, but you have deviate and all that. So I appreciate the variety that you guys are able to do.
Thomas.
Um, you would, I don't know if I missed it because I had some barking dogs in the background here, but you noted, can you mention again your funding mix, where the main sources of funding for the service?
Yeah, I've got a slide on it too. I'm not going to struggle to re-get my slides up there,
Okay,
but I'm happy to share the slide deck with you and you can share it
sure.
with people who joined. But Wave's budget is about 2.2 million. And I would say about 50% is coming from state and federal sources.
Okay,
So local bus operating formula funds is just shy of 40% of that, right? There's a formula every year that we follow for those things. And then there's additional state and federal awards that allow us to do very specific programs. Then next, so that's a little over 50%. Just shy of 30% are local government agreements. So the townships, municipalities, and then now Washtenaw County. So with Washtenaw County, we're probably a little over 30% on that. So that already makes up over
okay.
80% of our budget. And the rest is like fares are 1%, donations are 2%. Yeah, so the rest are all smaller bits that make up the rest.
Wonderful. Looks like we also have a question from Nikki. Um, Nikki, you want to go
Hello.
ahead
Okay,
and
cool. I see the
yeah,
mic moving. Um, I have the same question as Thomas, but specifically about the demand responsive service that you have to reserve to Bride. Is that also open to anyone that can reach the service area?
It is. Yep.
Yeah,
Soon we won't be able to give a discount to someone we don't have verification that they're an
that's
older
fine.
adult and we don't have verification that they're having a disability or need accommodations and things like
I
that.
can,
But
yeah.
if you are in the area, you can request the service.
Yeah, I can understand that the taxpayers get the preferential treatment on the fares because they're already paying for the service in their
Mm-hmm.
taxes.
Yep.
Um, but yeah, some other people on this call I'm going to have similar questions for later. Um, Also, I noticed the map in your background says that you serve Grass Lake Township only on Tuesdays and Thursdays?
Correct.
Why don't you serve that township on any of the days Jada serves it?
So this is a great conversation. And I'll try to make the answer short. Really, it comes down to money. Last year we piloted it. We piloted it 5 days a week, with the understanding that the township and the village were going to work to reach a certain threshold. We've got some other grants coming in that help offset the costs for them, and instead of growing those funds, they actually decreased their support. And then with that, our funders were like, well, if they're not prioritizing it, then we need to put some of our funds elsewhere too. We have enough data to show that the need is there. And so Tuesdays and Thursdays was our compromise. And we talked with Jada. Actually, one of the Jada folks lives in Chelsea and uses our services sometimes. So he and I have a lot of good conversations. But while it would be great if we could be there together on Monday, Wednesday, Friday when Jada is, we're meeting like right at the line on Monday, Wednesday, Friday. And so really on Monday, Wednesday, Friday, Jada's making sure that people are getting to where they need to go in Jackson County. And if people have appointments in Washtenaw, we're kind of covering them on Tuesday, Thursday. And so as we're talking through all of the options that transportation service could be, we kind of figured that this way the township and village have 5 days of coverage. It's just not 5 days of coverage anywhere they want to go, if that makes sense.
So someone needing to transfer there'd still be a specific point they could do that on Monday,
Yeah.
Wednesday, Friday?
Yep.
Okay.
Wonderful. Well, I'm sure we could keep asking a lot of questions of Marie, but we have two other amazing providers that we're going to hear from. So, and then I think some of the other questions that are in the chat, we can either have Marie, if to the extent you're able, or we can discuss some of those in the Q&A. So thank you again, Marie, for sharing all of that great work. And we've got, in some ways, some different, very different types of services. So I'm excited to invite Evelina to share with us more about how People's Express works and in all of the different communities that you guys operate. What are how did you guys get set up the way that you are? What communities do you serve, and how do you juggle some of these questions?
Awesome. Well, thank you. I've actually been fighting Zoom to get my camera working this whole time.
Oh,
So
no.
unfortunately, I apologize for everyone. I won't be on screen, but I do have some slides to share. Let's see, can everyone see that?
Not just there it is. Okay, great.
Perfect. Thank you for the introduction. My name is Evelina Taylor. I'm the interim managing director at People's Express. We're definitely driven by purpose, powered by people, and I'm very excited to talk to you guys today more about rural transportation. So a little bit about People's Express. We actually started in the 90s as part of our local food pantry, Whitmore Lake Area Human Services. They recognized it's great to have this resource for the community, but it's not so great when people can't access it. And so they created a specialized program called People's Express. Very quickly, though, that program grew to provide transportation around town. And that was very effective, demonstrating the needs of not just the local food pantry, but other resources within the community. Over time, our neighbors in the neighboring communities came knocking and also recognized the need for transportation services. And we quickly grew in 2007, we became our own 501c3 nonprofit. So we've been providing services for over 30 years. Our primary transportation we deliver is curb to curb and door to door transportation across Washtenaw, Oakland, Livingston, and Wayne counties. For in the city of Detroit, People's Express actually provides the paratransit services in partnership with DDOT. And then in Oakland County, we do partner with the county to provide that demand response public transportation. Our mission is to help people stay independent and connected to their communities, being active. And how we do this is through our lifts. All our vehicles are lift equipped, and we train our drivers very heavily in safety and customer service. We offer services door to door from to doctor's appointments to grocery shopping. Pretty much you name it, we got it. We're a one-stop shop for transportation needs. Our mission, more clearly, People's Express is dedicated to providing safe and reliable public transportation to empower all individuals to maintain their independence and enhance their quality of life. We do pay special attention to those in underserved populations. More specifically, we also limited access to transportation due to rural geography. I did want to highlight some of the new programs and expansions of People's Express in Washtenaw County. With the WAVE, JFS, and People's Express, the county has provided transportation for those 60 age and older, and that's free rides anywhere in Washtenaw County. I think I do have a little map here where you can see that you can travel anywhere in Washtenaw County, and there is that collaboration between JFS, the WAVE, and People's Express to provide transportation across that greater Washtenaw region. So one of the important takeaways for rural transportation is that low density does not mean low need. I think that is where when we're looking at funding priorities and trying to understand the needs across a region, understanding that rural communities have a distinct need for transportation. Oftentimes, this is more to access essential resources that are located outside of their communities. For medical appointments, our insurance providers don't always give us the choice of where you can go for your medical appointments, especially within the region. We have a lot of specialty care centers that sometimes can fall outside of county jurisdictions or community lines that people still need to get to. Same thing with grocery and pharmacy trips. We do see in rural communities that oftentimes there's limited SNAP retailers, and those who are wanting to access more affordable grocery stores have to travel outside of their community. Employment opportunities as well. That is an area where people are oftentimes seeking jobs outside of their hometown, and that requires dependency on transportation. I always like to use our backyard. So People's Express is actually located in Northfield Township. And Northfield Township is a perfect example on transportation as a community resource, because up until recently, we didn't have any medical facilities within the community. We just got a federally qualified health center in the last couple of years. But before that, many people have to travel to Brighton or Ann Arbor to seek their medical care. We also don't have a large grocery store within the community. So again, people are traveling up to 20 miles just to seek getting their weekly groceries. And because of our smaller population and economic footprint, oftentimes people are seeking employment opportunities outside of our community. All that being said, those longer distance trips oftentimes increase your dependency on your support network, and it's a little bit more difficult for individuals who don't have the privilege of owning a car to seek neighbors and friends. It's not just going down the street to get some groceries, but it is a higher commitment for transportation access. Another obstacle for rural transportation, and that is Lyft and Uber is not always available. Here we see two needs not always guaranteed. One is reliability. People oftentimes, when you're scheduling doctor's appointments ahead of time, want to be able to guarantee that they have a pickup and a return trip scheduled, as well as those who have ADA requirements that Lyft and Uber is not necessarily conducive. We see this especially, someone might be able to get a Uber from Ann Arbor to the rural communities, but they can't get the reversal. This is especially important to understand as where you live should not determine whether you can participate in life. Some challenges we see, so there is definitely a desire when we just talk to community leaders across these rural communities, there's a desire of how can we collaborate, how can we connect these communities together? Because people are seeking services outside of your community, is there a way we can resource pool and share those costs? However, some of the obstacles we see is that different municipalities have different general funds, and that leads to different levels of financial commitments that they're working with. We also see individual municipalities have different priorities when it comes to transportation and what they want to intentionally put towards different initiatives. So to kind of give you an example, in Oakland County, prior to us working with on a county-wide lens, we had about 7 different contracts with local communities. Each one of those contracts had different service hours, different driving boundaries, different fares. One example of a different priority is one of our communities had residents that were non-seniors and non-persons with disability was charged $10 one way because they wanted to prioritize that the services that were being offered were being utilized for those who needed it the most. And in this case, it was prioritized for seniors and people with disabilities. I think the WAVE can relate, as we were discussing earlier, that they had limited services for Grass Lake. We definitely have to work through those obstacles of that fragmentation between services. So there's definitely a collaboration, but structural obstacles can prevent us from connecting communities from one another in the rural footprint. Touching on some inequities in services and what are the different trade-offs between the modes of delivery for rural transportation. So fixed route services are those that can be effective. However, it can also inhibit those who might not have access to travel the distance to where those fixed routes are operating. We see that in some mixed-use communities that have both rural and urban areas, they, in their general funds, may prioritize a fixed route service. However, it could potentially only service a portion of the community, leaving those individuals who just so happen to live on a different street the inability for access to those services. Microtransit zones has also been another area of newer pilot projects. And this is a zone that allows you to really identify where your services can be the most effective by increasing your rider capacity to that zone, and it also lowers cost. However, when microtransit zones don't service a whole community in its whole lens, it's sometimes ineffective of meeting the needs of the entire population. So there's that trade-off. Do we increase the rides available for those who are in that zone, or how can we service the community as a whole? I did want to highlight, so this is, I know it's kind of fuzzy, but just one example of a rural community is Superior Township. Oftentimes we see people moving to rural communities because it's more affordable in housing, especially for those who might work in the Ann Arbor, Ypsilanti urban areas. They're seeking their housing in greater Washtenaw County area. However, when you're looking at the transportation cost, that oftentimes offsets the affordability of housing. And there's that housing plus transportation index. Here you can see Superior, they have between 55 and 65% makes up of someone's income, when the target is to consume no more than 30% of your income. Other hidden obstacles that I wanted to highlight about rural transportation is with rural transportation, you're not always having access to sidewalks, which can make it especially more difficult for safe boarding, as well as we're experiencing winter conditions in Michigan. Your roadways or driveways might not be entirely clear, and that poses both safety risks to the clients and to the drivers that can prevent timely transportation. We also have encountered obstacles as it comes to ramps being ADA compliant, which prevents an individual from safely exiting their homes, and also connecting them to programs that offer opportunities to have a PCA when someone has a little bit more complex medical needs and needs to have a company on their rides. That was overall just some highlights on transportation. I did want to just one of the couple different areas of feedback that we get from our riders is the fact is without transportation, they would not have a job. Oftentimes that those who can't afford owning a car, especially with the cost of insurance, we do see a high needs in our rural areas for work access. We also, I've gotten feedback on individuals who've been using Lyft and Uber, and they didn't realize that this is a resource in their community. And they were letting us know that they're spending hundreds of dollars every week on Lyft and Uber, not realizing that there was a resource offered by their community. Some other perceptions that we oftentimes struggle is that transportation is a senior program and not a transportation for all. And we hear oftentimes when people realize through word of mouth that they can also utilize this service, it's definitely a game changer for a lot of individuals. We actually had an example where an individual thought that we were medical only transportation, and so they used us after they had surgery, and they had an issue where their car broke down, and they didn't have access to a car, so they called us up begging like, "Hey, can you please make an exception? I have no other options," and we were like, we can do this now," and they were just so happy and didn't realize that this wasn't just a medical service. So community awareness is a big thing for transportation. Oftentimes, until you need the service, you don't always realize that the service is available. And that is one of the areas that we're working on improving across Oakland and Washtenaw counties is letting people know the service is available to them.
Wonderful. Thank you so much, Ms. Taylor. I really appreciate all of this information, and it does seem like you guys serve quite an expansive area. I know that you have another meeting you have to get to in the next 10 minutes, in about 10 minutes. So I did want to see if there were any particular questions for you, for Evelina. All right. Nikki, to start things off.
All right. I warned you this was coming, but it is my understanding that People's Express, as well as WOTA, NOTA, and OPC, are all limited to only serving residents of their service areas. Am I incorrect in saying that?
So we have direct contracts with the county for 8 specific communities. However, I will say, well, it's not formalized, but we do service, I think, about 7% of our current ridership in Oakland County. We're partnering with those who are in neighboring communities that smart services are not conducive. So we do have a mobility manager on site where when smart services are not available or conducive to someone's transportation needs, we work with our dispatch team to see if we can provide transportation for them.
Okay, because I am a Macomb County resident, and I have friends in South Lyon, friends in Lake Orion, places I want to go elsewhere in Holly and Independence. And the information I'm seeing on your website would lead me to believe that I just cannot make those trips. So you're saying it is possible if I were, like, I understand you're not going to drive out to East Point to bring me to South Lyon, but if I go to Wixom, for example, could I then request a trip to South Lyon?
Yes, that is something we could definitely set up. One of the areas that we're looking to improve across the providers is through new software, having that coordination where someone can transfer from one provider to another and be able to connect across communities, especially those who might be in the smart service area and is looking to get into more of the rural communities that you were speaking of.
Okay. That is good to hear because I've been concerned about that because there haven't been any changes to stated eligibility on all of these providers' websites. And like I was not a vocal supporter of Oakland countywide transit just to continue to be locked out of 66% of the county.
I think we've done, I will say People's Express, I want to say grew 192% in Oakland County communities from going from community-based contracts with those 8 local municipalities to working with on a county lens. So the last couple of years has been definitely trying to increase capacity for our existing communities, but I think software is going to be a huge opportunity for all of us to be able to coordinate and integrate our services to have that seamless transfers. So we're definitely very excited and optimistic on that increased capacity.
That's very good to hear.
I do.
I have a
Oh, go.
question for Megan related to this, but that can wait until later in the night.
Okay, sounds great. No, I think you bring up an excellent point, Nikki, that and I know all of these providers are continuing to evolve, and that they absolutely must prioritize both the people with the greatest needs in their communities and the people who are funding it, but to the extent that that can be expanded out to people who want to visit those communities or shop in those communities, to the extent that can be expanded out to people who don't necessarily have disabilities or that I really appreciate all of the efforts that are being made to expand that. Are there other questions for Evelina before she's got to hop onto another?
I could just say to Thomas' point about rural transportation. I do know that other programs call it non-urban, went to try to have a better term. Oakland County, I understand, especially as there's been more developments in the southwest portion, where that's I think seen more mixed uses. But with Washtenaw County, I think we definitely have been focusing on how can we connect the rural areas to the urban and having those conversations. So you can't talk about urban transportation without also talking about rural transportation.
That is an excellent point. It is definitely a shorthand that doesn't anywhere near address all of the communities, and of course we have such a diverse breadth of communities. So non-urban might be a better term, but and then of course y'all provide so many different types of service. So thank you again, Evelina, for what you're doing. Hopefully there'll be some great expansions in Western Wayne County in the next year, and many of these services can be expanded as well. So thank you again for joining us. And we still, I'm very excited to hear from Kim to tell us about West Oakland Transit Authority, that also has been growing leaps and bounds and figuring out a wide range of ways to serve diverse communities. So Kim, can you share with us a little bit about your service and some of the people that you serve?
Absolutely. I'm trying to figure out how to share a screen. There we go. Don't know, is that sharing?
Yes, it is.
Okay.
It's, you might,
So
I
you
don't know
have
if you can
WOTA's
scroll
fast
in
track
on it a
showing?
little bit. Yeah. I don't know if you can zoom in on it at all, but we can see it. Thank you.
Okay. So WOTA is definitely a lot of rural area, and I saw a question here saying that we don't have a lot of working farms, so there's a question as to whether we truly are rural. Rural doesn't need working farms. It's primarily based on the aesthetics of the territory. In the WOTA territory, we have lots of areas that are dirt roads. For the average location, there is 0.84 people per acre. Your cities will have 10 plus people per acre, or not even per acre, per city block, basically. So there's a lot that goes into defining rural. Also, the average ride that we provide is 19 miles one way. And the best way I can define it is that I tell everybody the difference between rural and urban is in an urban area, you can go 1 mile and pick up 10 people, and most of those 10 people probably live on or very close to sidewalks and could probably, if absolutely necessary, get to a lot of the things that they needed to get to without needing transportation, such as the close grocery store, gas station, stuff, different, even your library, stuff like that. Whereas out in the rural areas, you will go 1 mile or go 10 miles to pick up one person, and you may not even make it to that person in that 10 miles. And obviously in WOTA territory, we don't, because it takes 19 miles on average to get to somebody. Some of our rides are as much as 27 miles one way just to be able to pick up a person. And yes, we do have areas that are not rural, such as the city of Walled Lake and Waterford. But according to the US Census, most of WOTA is rural, and that's what we go by. On our fast facts here, so WOTA was established in 2020. WAVE and PECS have many, many decades of service over what WOTA has. We started in 2020, right before COVID hit. We never shut down. We did reduce our rides temporarily for about 6 months, and then we were back in the swing of things. In 2020, we did 15,000 rides. In 2022, we were up to 32,000 rides. In 2025, we're up to 101,000 plus. So we've done a 300% increase since 22, thanks to the millage and thanks to the taxpayers. We appreciate that because we have been able to prove the expansion that we've been able to do. Last year, we traveled over 1.5 million miles. We have a 94% on-time performance report. Unfortunately, software is not without its faults. So if we are 16 minutes ahead of time or 16 minutes beyond time, then we're not on time according to the software system. Our rider satisfaction rating through several different census that were set out is 97%. Our dispatchers are taking over 500 calls a day. We have 104 employees at our last count, 60 vehicles, of which we have anywhere from 47 to 52 on the road a day. We are required to keep at least 10% off the road per FTA requirements, so that if something breaks down, we have a backfill. We also have breakdowns all the time, and we've been involved in, because of a lot of the great weather we've been having, we've had a lot of fender benders. I don't understand how people don't see us, but they ride right up on us and run into us. We do cover a service area of over 500 square miles. Our priorities are set for elderly, disabled, low income, and veterans, and then general population. General population is up to about 10% of our ridership. Our top destinations that we do travel to include medical, employment, retail, and human services. And right now we just submitted for a grant to be able to get a larger facility to, and we're hoping to possibly be able to connect services and work in collaboration with PEX and SMART at this new facility when it comes around. The primary job of WOTA is to serve the residents. And yes, we do primarily take residents within our WOTA territories, but every month over 600 rides are provided to individuals who are outside of our territories, who either cannot get connector rides, who cannot get service in their areas, or who need to go further than what their current provider will take them, and we can take them that extra mile. We have several people, as you can see here, who are very happy with our services. We serve a lot of different dynamics. One of my drivers, her mother goes to dementia daycare, and we're the ones who get her there. So my driver can work and her mother can be taken care of during the day. And then she's brought back to WOTA, and my driver takes her back home, back to our WOTA office. And let's see. We just recently moved. We have 2 locations now. Both of them are in Highland. One's in the west side, one's in the east side. So we are able to expand our employee base, and we are able to add more dispatchers, more trainers. We are looking into getting a designated mobility manager who will be assisting with people needing to take longer trips, needing to do connections both into and out of WOTA area. We are looking into creating some deviated fixed routes. They are not that easy, and they are a process to go through in order to get them put into place. It requires several hearings. It requires substantial funding, and it requires making sure that it's even a process that will work. Once we put any of those into place, whether it be a fixed route or a deviated fixed route, if it doesn't turn out to be a positive aspect of our services, it takes at least 3 years to shut it down. And there's a major process to go through that. So I understand that some of you think that having fixed routes and deviated fixed routes is great, and in some areas it is, but for us, especially being on the back roads, the dirt roads that may not even exist during normal times, during inclement weather, those kind of services don't work really well. We don't have a lot of major intersections or major thoroughfares that the fixed routes and the deviated routes can find placement for. We are working on connecting with LETs so we can bring Livingston County members into Oakland County, and we can get Oakland County people into Livingston County. We also work with MTA so people can get up into the Flint area and vice versa. We work with SMART all the time. We're doing connections almost daily with NOTA, with several with OPC. We do some with PACS. So we're very connected with all the other service providers, and we are doing everything that we possibly can to get people to where they need to go. We are operating 7 days a week, and we are looking in other areas as to how we can expand that as well. So.
Excellent. Thank you. Was there more you wanted to share, or was that what you were primarily wanted to go over? I don't want to stop you if you had more to go.
No, I'm good.
No, that is definitely great to hear, and it is important for those of us who live more in the cities to recognize some of the challenges that you guys are dealing with. It's really interesting to hear about some of what you guys need to work through in order to provide the rides that so many people are depending on. I know that some of your colleagues before had mentioned some about their growth, and I know, I guess, to some extent you got a shorter time frame, but yeah, to what extent was that? Did I see? Yeah, 101,000 rides. How has that been growing over the last few years? And are you getting more requests or demand for rides? Are you able to pretty much serve all of those requests or that ridership, or is there still more demand than you're able to serve?
There's definitely more demand. Considering that we're touching 101,000 rides in a year, we're pretty much looking at several thousand people. We serve an area of 169,000 people. Oakland County has 1.3 million people in it. So we're not even touching the surface, in all honesty, of everyone out there that could be riding. We are trying to keep up with demand as much as possible. We can only provide as much service as what we have vehicles and drivers for. So,
and I know that's been a huge challenge across the entire transit sector, is ensuring having enough vehicles, keeping them maintained, and having enough drivers. So no, I know that and I appreciate your what you were saying about seeking to grow carefully. You don't want to grow in a way that you can't provide the quality service that people that so many people have been depending on.
Exactly. That's like bringing anything new into, such as a deviated fixed route or any other type of services. Microtransit has been suggested. We have to look into that very carefully, because obviously it'll take financing from what we do currently do to be able to support that, and drivers and time. And I've always had a philosophy running WOTA, and even prior to that I don't want to go backwards. The absolute worst thing that you can do, especially to the elderly and the other riders that need us so immensely, is to give them something and then take it away.
Yeah.
So
I hear you.
I want to make sure that if we go forward in any of the different types of services that are out there, that it's something that is definitely sustainable and supported. Just ridership in itself. I mean, we get a lot of cancellations due to the weather, due to health conditions, due to, oh, my daughter's going to take me instead. We get a lot of that. So that's also a factor that we have to consider when moving forward. We don't have, other than M59, we really don't have a lot of thoroughfares. And on M59, I know numbers back in 2025 were like 142 riders in a day for a 16-hour period. That doesn't seem like it's serving enough. And if you go down 59, you have to be able to get to those fixed stops. Even on a deviated, you have to be able to get to those fixed stops. There's not a lot of residency that can walk to M59, especially out in our areas. So it makes it really, it's a challenge. It's not a challenge that we're going to dismiss, but it's a challenge that takes a lot more research into and probability.
Yeah.
So
I did see that on your website that you guys have been able to add in kind of reminder texts and calls. Is that helping to, has it been happening enough? Is that helping to address some of the no-shows or the cancellations? And how far ahead of time are you generally scheduling? Are you able to make changes? Do you have the technology or the staffing to be able to make relatively short changes when those things do come up?
we do have the staffing. Our software is a bit of a dinosaur,
Okay.
and we're held to that for the time being because Smart has gone out to find software for WOTA, OPC, and PEX and Smart to all use so we can all interconnect, which will also make travel much easier if we're all on the same software system, because we can see what everybody else is doing and be able to merge into that. So we do have that deficiency with an inadequate software system. They just don't keep up as well as we would hope they do. But yeah, we started the IVR system and it has been helping. We're able to send notices out to everyone to let them know the driver's 15 minutes away so that they can start preparing for that. Or if they, if they're not planning to go and they're like, oh my gosh, I forgot to cancel. Now they have, that 15-minute window to call us and maybe we can divert our driver to go someplace else. It also helps them to realize, oh my God, I do have a ride. So I better get ready and get going. Or I have to call and cancel because I'm not ready. I completely forgot about it. And I don't even know that I have a doctor's appointment anymore.
Oh, geez.
Yeah, it's fun. We get very creative. My staff is wonderful. They try to help everybody as much as possible. We do have a wait list if they're unable to get on a ride. We do schedule up to 60 days in advance.
Oh, wow.
However, we don't do that for prime time. And our prime time, which is our busiest time, is from 6 a.m. to 10 a.m. and then from 3 p.m. to 6 p.m. So we only take those schedules 2 to 7 days in advance. But it helps a lot because while we let people do recurring rides, such as for dialysis or work or stuff like that, they tend to forget to contact us if they're not feeling well, if they go on vacation, if they're taking the day off and stuff like that, because they're programmed out. So if we don't allow them to program that far out, then we're not having so many unfilled spots that we can fill. So
yeah, that is definitely a juggle to deal with, just some of the human needs, just dealing with humanity, and especially dealing with people who are often the most either medically frail or the least technologically savvy, and still making sure to respectfully get them where they need to go. I did want to open it up to questions to both Marie and Kim. I'm not sure if Zanaya, if you had any particular questions that you wanted to pose to them. I
did have one question. I was wondering if you all's services were included in the transit app. So if we were in the area, would we be able to see your services through the app?
So Wave is on an app called Ride Pingo. And because their app is like they host it, any transit agency that uses Pingo could also come up in that area. Wave is the only one in our area currently using Pingo, so you would only see our services currently. But Kim, did you guys have a rider app yet? Or is that part of the transition you're waiting on with Smart?
It's part of the transition we're waiting on with Smart. We currently have Q Ride,
Mhm.
and it's creative.
That's generous.
All
So
right.
no,
Thank you.
supposedly we'll have an app when Smart decides on what system we're gonna all have.
And trying to find something that can handle both the scale of rides that they offer and also the kind of precision of the demands that you guys have. I imagine it's challenging to find something that'll work for everybody, but I do look forward to being able to for there to be some more connection. Other questions that people may have. Want to open it up and see who else has. I will come to Tom and to Nikki in just a sec, but I did want to give an opportunity for a brief moment to see if anyone else had questions before we circle back. But if not, then sure. Tom, your question.
Well, I just wanted to say, I mean, it's kind of a little disappointing to hear about all the difficulties and the challenges of running, fixed or scheduled. Really, that's what it's about. I mean, the way I see it is that paratransit, so on-demand services, are not really public transit. They don't do what public transit is all about, which is its main purpose is to facilitate greater population densities. And it has some other knock-on effects which only become apparent when cars are in the picture, like environmental and social benefits. And it's just kind of weird that we heard the challenges about that, but there's actually a lot of good reasons to have that, because it's very inefficient to run one vehicle out to get every person, when if you have a number of people that are going in the same direction, in the same place, we can have just one bus get them all. So I'm kind of, we were promised, if maybe not everybody remembers this, but there was plans to have fixed route bus routes, not just on M59, which did actually happen, but also on some of the other major highways sort of in the periphery of Oakland County, including Dixie Highway, which does run through WOTA's service area. So I'm glad that this is being worked on, but I should just mention to people that these, we can't just go out and talk about how challenging these services might be, because there are corridors where it could easily work. And there's maybe only 150 people using Smart's Route 759, but that's still, I mean, think about how many smaller buses it would need to capture that same number of people.
I do want to flag. I don't believe there was any promises of fixed route. There was consideration. There were outlines of what could be. But no, I do hear you, Tom. I think you bring up some great points that fixed route can be more efficient, can have more environmental benefits. But I do appreciate, Kim, you bringing up the challenges that you are working to overcome. Did you want to respond at all, Kim?
We have looked into fixed routes out in our area. And like I said, given the nature, we have also had several meetings in which SMART was involved, and Dixie Highway has been brought up, but SMART and Michael Baker Associates did a lot of research on there, and it doesn't support at this time having a fixed route down that avenue. Just like a lot of the others, like I said, there's a lot of research that goes into it. There's a lot of funding that has to be allocated for it, not to mention it's a different type of vehicle that has to be utilized there. WOTA doesn't have the 50-foot vehicles. We can't get them down our small streets, and so we don't have those. So there is demand for more fixed routes throughout Oakland County, but again, fixed routes are under SMART, and we do the demand response.
Okay. No, I appreciate that. And that it sounds like, again, there is interest in seeing that. Hopefully those conversations can continue, and whether it is WOTA providing some sort of deviated fixed route, or whether it is SMART or others being able to layer that in. I know that these services will continue to evolve. So appreciate the input there, Thomas. I want to jump to Donald, and then we'll come back to Nikki. Donald, you wanted to? Oh, I suppose I need to. There we go. There's the.
Hello?
Yes, we can hear you.
Okay. Yeah, thank you for the great presentation. I was just curious as to as Wayne County starts to talk to communities about our proposal that's on the ballot. I'm curious, can you tell us a bit about your experience talking to people in the communities that you serve about the need for public transit and why it's important and things of that nature? Because there are some communities in Wayne County that are similar to the areas that you serve, maybe we could take some things that you've learned and use those in our discussions with those communities. So I would love to hear your thoughts.
So what I know from our experience in Oakland County is when the millage was coming through, a lot of the communities were not interested in it. They didn't feel that people needed public transportation. The mindset for a lot of people was that everybody has family and friends. They don't need a public service, such as public transportation. So a lot of people out in the rural areas, the WOTA, NOTA, and PEX areas voted against it. Some in OPC areas as well, because they were afraid that they were just going to become donors to the millage and they weren't going to see anything in return. Since then, since we've been able to expand our services, since we've been able to show that public transportation is definitely a needed service in our areas, a lot of people have changed their mind. Even the community leaders are looking at this is something that in the future they would like to support. So when the next millage comes along, I don't think we're going to have as many that are going to say, no, we don't need this, because if they're not already riding us by then, they'll know a lot of people who are riding us, and NOTA and PEX and OPC. It's a service that you really don't realize you need until you need it. And then by the time you actually need it, if it's not there, it's not going to be there. When I started in transportation 12 years ago, you could not get an Uber or a Lyft to this area. There was nothing coming into Highland or White Lake, Rose, Holly, Groveland, Springfield, Milford, parts of Commerce. You couldn't get anything out here. And while they're available now, they're not affordable for the majority of residents who are riding us. I mean, $2, I can take somebody on WOTA from Holly all the way to 696 and Orchard Lake Road for $2. I can't get that far in my personal car on a gallon of gas. So, and my gallon of gas is going to cost more than that $2. So, you just have to stay diligent and let people know that while they may not need the service, if they look around at their neighbors, if they have any elderly, if they have any disabled, we have so many disabled residents who want to be active members of society, but because of their disabilities, they will never be able to drive. We bring them to that. We had, and this story sticks with me immensely. One of the people that works for me, she was at another meeting and the question was asked, what over the weekend was something that stands out that happened to you? Well, this one lady stood up and she said, well, it didn't happen to me, but it happened to my brother. My brother has been wheelchair bound for 3 years and he hasn't been able to go to church in those 3 years because we can't get him there. But WOTA, because they have wheelchair lift accessible vehicles and he lives in Waterford, he now goes on WOTA to go to church every week. And it brought tears to people in the room because that's something that a lot of us who can drive, who have our faculties about us, that we take it for granted that everybody can do this. And not everybody can do what we do. Not everybody can get in a car and drive wherever they want to. They're stuck. Not everybody has family. And most of, especially the elderly, their friends are in the same boat as them. They're elderly too. So it's a growing need. By the year 2035, it's projected that there will be more people 60 and over in Oakland County than there will be school-age children. And that's a major number to be considered. A lot of our youth, when they graduate from school, because we haven't had transportation out in these areas, they're moving into the cities so they can get a job. Well, now that we're providing this transportation out here, they can get a job and we can get them to that job and they don't have to go downtown Detroit or Royal Oak or Macomb area or, those areas. They can stay out here and they can still be there to help mom and dad and or grandparents or, and still be in the communities that they grew up in because we're providing that service.
Yeah, you provide those are some great examples, and it is really neat to hear that more people in that area, more of the community leaders, are recognizing the value. We certainly try to communicate to people in advance of a ballot measure or something. Maybe you won't personally use it, but there are definitely a lot of people in your community that might. Marie, you had something to
I would
to
say
add on that? Thank you.
I would say that as you're working on, the voter piece, getting voters to vote yes on the millage, I think these stories that Kim is talking about, like that's critical. Getting it directly from the riders or people who see how it benefits their neighbors, getting them to, do little snippets on Facebook Reels, TikTok, whatever, making a short, like 3-minute video that can be aired and shared on Facebook, whatever social medias. I think getting those stories in front of more people will help solidify that this isn't just like, my money going somewhere and I'm never going to see it again. This is going to filling up the bus with people, getting people to jobs and things like that. And then I also think that you should be strategic with when the yes happens, right? So the voters vote yes. Now, where does that money go? Where is that going to? How is that earmarked, right? Like what portion is going to specialized services for older adults and people with disabilities, to get people in, and things like that. And one of the things I've been finding really helpful with we don't have a millage explicitly for transportation in Washtenaw County. It just so happens that our older person's millage wants to support transportation. And so I have to talk to each of my orange people here, each community that we have a contract with, and I have to convince them every year, every time there's new electeds in place, this is the value of transportation. And finding some tidbits that really speak to those specific communities as well as the people stories has been helpful. Like in Chelsea, that's our largest small urban area. I found a statistic from APTA, American Public Transportation Association, or something like that. But their stat is that for every $1 invested in transportation, $4 is generated economically. And so for a small urban area that's looking to grow, that's a really interesting number to, like if our investment is here and it does all of this, like that's something to think a little bit more about. So I think, you're kind of looking at two things, how to get voters to say yes, to get their buy-in, but you also need to have a plan. So you should be also thinking about the electeds who get to, guide that process.
Absolutely. No, those are some excellent points. We are at 7:30. We still have several questions. So Marie Kim, are you able to stick around for for maybe another 10 minutes? Thank you so much. We will go to Nikki and then perhaps Marguerite.
Before Nikki,
Oh, please go ahead. See.
James wanted to know, what should we ask our state and local reps to help you all out?
Stabilize our formula funding from the state. That would be helpful.
Yeah.
My first year at WAVE in 2023, we were getting 42 point something % of our eligible expenses reimbursed. The next year was 35, and then it was going to be 28% until they actually passed the budget in October. And it ended up being 35, and now they're projecting, 33. But rural transportation can be, in state legislature, can be refunded up to 60% of our eligible expenses, but they keep slowly pulling away at that, which means that we have to find more local dollars for it. And when we serve a rural area with some of these townships, like some of these townships can honestly only afford $2,500 to provide transportation. And so that's what we work with at WAVE. And so the more they cut that back, these communities can't cover the cost, which means we're looking at cuts in transportation. They're not funding, we don't have enough funding for all the expansion vehicles needed for our needs, let alone the growth that WOTA's experienced in just the last few years, right? And so then we're keeping vehicles on the road longer, which is more expensive for everyone. So, at the state level, that would be the most impactful, is the first thing that comes to mind for me. Kim, what about you?
Absolutely. And it would be really helpful if they could generate grants that actually work towards transportation. Most of the federal grants out there are geared towards highway and motor carrier and marine. They are not geared towards public transportation. They say you qualify to be able to apply for them if you run public transportation, but the way that they score you in the latest grant that I've applied for, which is the build grant, one of the things that they asked for is, how does our public transportation tie into commerce transportation? We don't move goods and services, we move people. So how can you connect the two? And I don't know if they're going to differentiate between that, and they're just generalizing when they put the instructions out there. But when you come across hurdles like that, how do we get more money for transportation? I mean, if the numbers who need it continue to go up, there has to be some sort of availability that is opened up to us. And, last year on the build grant, there was $448 million available. There was $10.9 billion in applications. So we need help with funding. If you're going to ask your legislators for anything, we need help with funding.
And absolutely.
Yeah.
Absolutely. And I had popped up just briefly that actually we need to update it, but all across in every one of Michigan's 83 counties, there are transit providers, and they are all struggling because at one point they covered 50% up to 50, almost 50% of the urban areas, and up to 60%, almost 60% of the non-urban, which again, shorthand for rural, but it's a mix. And then, that declined. And then in the last few years, it's been all over the place. And we were worried that it might drop dramatically. So we are fighting for an increase. The governor's budget, with the funding that was the sliver of the roads funding that goes to transit based on last year, would include about a 2% increase in this reimbursement rate. But that's not going to get us in the direction we need. We're pushing for at least a 4% increase. So I put in a quick action alert in case anyone hasn't had a chance to contact your legislators. So I will echo that. All right. I do want to make sure to get to Nikki and to Marguerite before we need to wrap up. Nikki?
My question was mostly for you, Megan.
Okay.
The challenges that Oakland Rural Transit has been facing, the expansions, the everything about that. How much do you think that's going to affect Wayne County millage results?
Honestly, I mean, well, there are absolutely challenges, and it is not, Oakland County certainly hasn't been able to provide all of the service everybody wants. I see it, and I have heard from many people that it has been very much a success, that there are new services in new areas, that some of these lower density rural providers have doubled and tripled the number of rides that they are able to provide. And yes, it is a slow progress of improvement and growth, but we are very much, with Wayne County millage, going to be pointing to a lot of the successes of the Oakland County millage in connecting more communities together, and in being able to provide far more services, connect a lot more people to a lot more places. So we really see, and yes, there is still a ways to go. And you've brought up a number of you and Thomas have both brought up a number of areas there where there absolutely needs to be further improvement and expansion as soon as it is possible. But I see the Oakland County expansion as being a big success, and we will be pointing to it for Wayne County.
Good to hear.
All right. Marguerite, I would, I know you use a lot of the paratransit services in Detroit. What's your question or comment?
Okay, thank you. And yes, I do ride public transportation everywhere. But I agree with Kim on the issue of people that realize that when you get older, you may become disabled too. And for those of you who know who I am, I love to be a compromised person, meaning that I will look at things and come up with a compromise to make sure that it works for everyone. Everyone needs to get involved. No matter where you're from, the rural area, and there is a question: the people who live in the rural areas, are there sidewalks or curb cuts in those areas, especially along the main highways? If not, we need to get the ball rolling, because in the next couple of years, or between 3 and 5 years from now, there will be a lot more seniors, like Kim said earlier, and I used to take care of my grandmother who used to live about 3 miles from me. And so ever since I got our girl house, helping her coming back home to my chores, stuff like that. But the young people need to realize that you may become disabled in the future. We all don't know what the future may hold. I'm done. Thank you.
Thank you, Marguerite, for sharing. You do bring up a couple of great points. Disabled is a minority group that any one of us could join at any point in time. I've pointed out many times, every one of us is one broken foot or one broken axle away from needing transit services. You never know. And even though, as Nikki's mom definitely experienced, so we never know when the need will arise. And yeah, it certainly is. If I was following you right, it is certainly easier and to provide services when people do live along denser corridors. But as actually, I think I'm trying to remember which of you was mentioning it, that that low density doesn't mean the low need, and that every single part of our region, every single part of our state, there are people who need these services. Any final remarks, Kim, Marie, before we have to wrap up? I really appreciate all that you've shared today, and the super important work that you guys do. And as I know Thomas had to hop off, but he did note to please know that his critiques are coming from a place of love. He wants we all want the best possible transit for everyone. So Marie, Kim, any final remarks?
Oh, thank you for having me.
Yeah, I appreciate it, Megan. People don't know what they don't know until they know. So
there you go. Absolutely. And I mean, I certainly learned new things as well. So Zanaya, anything that you wanted? Oh, why am I still sharing that? I apologize. There, didn't need to be sharing that. I meant to share that just very briefly. Zanaya, did you want to say anything about any closing remarks or any upcoming activities that you wanted to announce?
Yes, I just wanted to echo that thanks to all the speakers and all the people who asked a question through the chat or unmuted, which is even harder sometimes. And so I really appreciate the engagement throughout the Transit Tuesday talk. Very quickly, because I want to respect you all's time, we have True as a whole has a Capitol Day. It's where we go to the Capitol, we lobby for more and better public transportation, and we have a few specific um, focuses this year that we're lobbying on. You can go on our website at detroittransit.org. That's detroittransit.org to look into that a little more. I don't want to get into the details just to keep things brief, but that is something coming up March 12th. That is an all-day event. If you're worried about transportation, no need for that because True has you covered. So if you can make it to the Techtown office, that day, then we will have a ride for you to Lansing and from Lansing back to Techtown or in some of the various areas. All the details are on our website, and you do have to register ahead of time to join that. If you are new to lobbying or you just need a refresher, we will be providing two separate trainings for that on the 11th, March 11th, and also March 12th, after our volunteer meeting. And so if that interests you, please join us. We'd love to have you, and food is provided. Speaking of volunteer meetings, we will be having our March volunteer meeting, excuse me, March 11th as well. And so we'll have both of those going on. And that will be at 6 o'clock on Zoom. There'll also be a Transit on Tap. That's just a nice social event where we get together after the day at the Capitol, which would be a long day of work, and just get to wind down and talk about our experience or not talk about that at all and just enjoy each other's company. And so that is also on the horizon. Lastly, we will be having our first game night of the year, where, as Nikki can attest, I will be whooping butts and not taking any names or apologies. So if you like to see me become the reigning champ for 2026,
or if you think you
join
can
us.
take Z on in some of these games.
I would have said that, but I don't want to provide false hope, So if that's something you're interested in, we'll have some transit themed games, card games and board games, as well as some of the classics like Uno and things like that. And so if that's something that sounds fun to you, that'll be at Tech Town in March. I'm looking at the 18th-ish. We'll see when exactly that is, and that'll also be made available to you on our website and through email.
And I will say, we are working hard to set up the next couple of Transit Tuesday talks, but getting some of our speakers to confirm. We are working to put together one that is specifically about the Wayne County countywide transit expansion, tentatively with speakers from the county executive's office and from SMART and local writers and institutional leaders. We are working on that for March 24th, but stay tuned. And we're working to arrange one with the mayor of Detroit. She apologized for not being able to be at our State of Transit event, and so we are working on something towards the end of April that will be focused specifically on the mayor's goals and plans for the city. So stay tuned. We've got lots of great events coming up. Yes, Nikki, it will be an Indian Trails bus again. We did confirm that we will have an Indian Trails bus going from to take folks from both Detroit and from a park and ride location northwest of Detroit to take people to the Capitol and back. So happy to answer any other questions. Again, thank you so much, everyone, for joining us. Thank you again, Kim and Marie, for all of the wonderful work that you do and for all you shared tonight. So thanks, everyone. Have a wonderful night.
Thank you, Megan. And everyone else.